Are you everything okay?
Yes, fine, yeah, apart from the one ear.
Is it just the 1 ear?
Just the one ear.
Any other problems at all?
No, I've had it done. I'm trying to think, I've had it de-waxed once before, but it's at least 20 years ago.
Okay.
It's not as bad as it was then because I left it till the basically I couldn't hear from it. But I had a bit of a head cold, so I wasn't sure, and then started putting the drops in. And then it pained me in the night time, so I had to have an ibuprofen.
Okay.
So I think it is just a build-up of wax.
Okay.
I've been putting the drops back in at the night time and just having an ibuprofen because it does seem to hurt.
When was the last time you had the pain? Was it every night?
No, it was a couple of nights ago probably. Okay. And I had the ibuprofen as soon as I went, so it would have stopped any pain.
Can I have a look?
Yeah,
Did you get any?
It feels as though there's something in there. When I first get up in the morning, it seems reasonably clear, and then as the day goes on, it seems to feel as though there's something in there.
Lung infection.
Oh, is that what it is?
This side's okay.
Yeah.
There's a little bit of wax, which I'm happy to remove if you want to. Otherwise, it's not going to cause you too many problems.
No, this is the one. So
this side, basically, your passage is about half the size at the moment.
Yeah, because I've noticed this bit swells. I don't know what this part of your ear is, but that bit swells and I've got.
And is it hurting there as well?
It does hurt there, yeah.
So your ear canal is about half the size. I want to show you actually.
Okay.
So if you stand up for me for a second, just lay it down.
Now there's something in there, and I've just presumed it was possibly the wax.
What we'll do is, I'll show you on the screen what it looks like.
Okay. Because the wax is just basically sweat, isn't it?
So wax is sweat, a little bit of oil, and there's two glands. One's called the ceruminous gland, which creates a sort of a deposit that makes the substance of wax, and there's also oils and also dead skin.
Okay, because I say it was at least 20 years ago.
But in your case, it's not wax. It's just you've got an infection called otitis externa, which is a common infection of the outer ear. Have you been swimming at all?
No, I haven't. That's one thing I don't.
So just have a look. Can you see how your skin is quite granulated?
Yeah.
So this is basically the infection. I'm just going to go in a little bit just to see if I can see your eardrum. I can just about see your eardrum at the back there.
Yeah.
But when I show you on the other side what a normal eardrum would look like, you'll see.
Yeah.
But all of this basically, this is why it's hurting you. You've got an outer ear infection at the moment.
Okay.
So
is that like the white bumps? That's
the white bumps, yes. Yeah. And when I show you the other side, you'll see this is half the size. Your eardrum is right at the back there. Be careful not to touch your ear canal, but I can just about see it. Your eardrum is intact. There's no perforation.
Yeah,
that's the actual infection. So I'll show you on this side what a normal eardrum would look like, just so you got a comparison.
As normal as mine can be.
So let's have a look. So can you see how big it is, how wide it is on this side now? This is what I was saying when I was saying you've got a small amount of wax here. That's dead skin. Yeah. But if I just go above that, that's your eardrum at the back there.
Yeah, oh yeah, it's a lot.
So it's a lot bigger. You can see how clear it is.
Do you think it's worth getting that wax out, or?
It's not going to cause you any issues. It'll probably fall out itself.
How big is it?
It's only skin. It's mainly skin. It'll fall off itself.
Because I've actually had like a wax ball come out.
It will. Wax naturally falls out itself.
It tends to be this
comes out.
It's that this because to be honest, I can't hear the middle frequency this but I've never. But this one's been at 5. It more than compensates for this one.
So you need to get some antibiotics for that side.
Okay.
So you need to go see a GP.
Okay.
You definitely have got an infection called otitis externa.
Okay.
So the GP will probably once as I say, I've spoken to the audiologist. I've definitely got an infection. I'll write it down for you. And the doctor will obviously prescribe some antibiotics.
If I can get in to see you.
I know it's difficult.
Last time when he was to the surgery anyway, and it was the nurse that.
Okay. Yeah, but you need this normally takes about 7 days to clear.
Okay.
And once it goes, you should be back to normal. The pain will desist once it's been treated.
Okay. So it's not a pain. It's a pain I can live with, but of a night time when you're going to sleep, it seems to magnify.
You need it treating.
Okay. Yes, you can.
All right. I'll write that.